to demonstrate some of the treatment options that we would utilize if you did suffer from a whiplash type injury. Now know that before we do a lot of this type of treatment, an exam happens, some imaging might have to be taken, such as x-rays and things like that. But once we know it's safe, we then start working on different levels of treatment. We start as conservatively as we need to based on the patient's pain. So sometimes we'll be using, instruments and pain cream. Sometimes we can't even adjust manually up here, or when we use the word adjust, put pressure through the joints. So we have to utilize things like adjusting instruments and things that are much, much more conservative. We're gonna act like this patient, Caitlin, has moved far enough along where we can do hands-on muscle work, and I'll show you our adjustments of the neck and upper back. So some of the things we consider, right, was the trauma on the backside or was the trauma on the front of the neck, which can happen. Sometimes immediately after accidents, people actually get hoarse and a sore throat, and that's because there's swelling on those muscles on the front of the neck. So, but what we do is a lot of active release, and so we feel around for tight areas, and then we slowly just start taking her through ranges of motion, right? We want the muscle to be short, and then we put our pressure in there and we try and lengthen that muscle out. The great thing about our active release is that we also have learned how to treat the tiny little ligaments in between each one of your bones. And so there's ways that we can slide in there a little bit, get a little bit of tension, and we start taking you through our ranges of motion. The important part is that muscle, this is just an analogy, a good way to show it, is muscle should sit like this. When we have these injuries where it stretches fully and then recoils back, sometimes it just isn't sitting right, the muscle or the tissue, okay? When we're doing all, and then it loses its blood flow, some oxygen debt, and things like that. When we go in and do our muscle work, all we're trying to do is increase blood flow, increase oxygen, get that tissue kind of sitting better, which then allows for better ranges of motion. And so we would work that all the way around her shoulders, her neck, her low back, on traps, rhomboids, her SCM, which is this muscle that runs down the front of everybody's neck. And we just start one layer at a time working through all the muscles and ligaments, right? And then we do go in and adjust. And, we've used the word adjust. Some of you might not know what that looks like, and that is just when we take them to their end range and we just put a little bit of pressure in there, right? It doesn't need to be a big, scary motion. Sometimes the noises bother people, but we talk through that, or we use other tools if needed. But we adjust on any areas that have restriction. Good. And then for a lot of these people, they will also have that mid-back tension, right? That is from that quick recoil, the seatbelt there, and just a loss of motion through the mid-back. And so we just roll them over and we go ahead and give them a nice little adjustment. What this does, that'll increase all that motion in the joint so she can turn her head, she can bend down, she can go through all her activities a little easier throughout the day. So this is just a quick example of some of our treatment options that we utilize when somebody suffers from whiplash.